President Trump remaining at Walter Reed Medical Center, now entering his third day of treatment. He briefly left his suite yesterday to greet supporters from at a distance, at least inside his SUV. White House doctors say the president could return to the White House as early as today, although others questioning some seemingly conflicting comments that came around his health over the weekend and when he tested positive for the virus. Eamon Javers has been tracking all of this moment by moment throughout the weekend, and he joins us this morning. Eamon, what's the latest?
Yeah, good morning, Andrew. We did not get a lot of clarity over the weekend. Some new details from the White House medical team. They were at pains to paint an upbeat picture here about the President of the United States, suggesting that, as you say, he could go back to the White House as early as today. Now, that wouldn't be a discharge as we think of in the traditional medical sense. You know, you're cured and you're freed from the hospital. This would be returning to the White House, where they also have elaborate medical facilities for further treatment. We'll wait and see whether that can happen. But meanwhile, the White House not providing some key information here, including when the president's last negative test was before Thursday. White House Press Secretary Kayleigh McEnany was asked about that yesterday, and here's what she said.
Again, not giving a detailed readout of his testing, but safe to say his first positive test was upon return, or at least after Bedminster, that trip.
Now, the White House had also initially suggested that it would provide numbers or details around how many White House aides had contracted the coronavirus. Now, though, Kayleigh McEnany saying yesterday the White House is no longer going to do that, citing privacy concerns. So no information from the White House on an aggregated basis about how many aides have contracted the virus at this point. And that lines up with some of these shifting accounts that we've had throughout the course of this episode. Starting with Thursday, when the president said he was tested and awaiting results, we do now know from the timeline that the president had an initial positive test before he appeared on the Hannity program on Thursday night and said he was still waiting for results. The president already knew at that point, according to the White House timeline, that he had at least once tested positive on an initial test. On Friday, we saw the president tweeting at 12:54 a.m. that he had tested positive. That was Thursday night into Friday morning. Meadows, the chief of staff, telling reporters that the president tweeted the results as soon as he got them. Now, on Saturday, the White House doctor said that they were 72 hours into the diagnosis, but then later issued a clarification saying that the president was, in fact, first diagnosed with COVID-19 on October 1st. So some confusion over the timeline over the weekend, some confusion over whether or not the president had received oxygen on Friday. The White House medical team ultimately admitting that the president did receive oxygen on Friday after initially trying to dance around that subject. So some confusion around the president's overall health here, but doctors painting an upbeat picture yesterday, and we'll wait and see if they can, in fact, send him back to the White House later today. Andrew, back over to you.
Join us now, Dr.
Hey,
Scott.
Amy, before you go.
I thought we were getting straight to Scott. Okay, go ahead, Andrew.
Okay. Well, no, I just wanted to ask real quick. I apologize, Eamon, in terms of it, because it's a workplace. Sure. It's a workplace issue inside the White House in terms of memos and notes going out to others, being told about who has it, who doesn't, and how that works. How is that working? Because we learned, I think, that notes were just sent out for the first time late yesterday.
Yeah, that's right, Andrew. And in fact, people I've talked to who are familiar with what's going on inside the White House compound right now are frustrated at the lack of communication that they've had, virtually no guidance once this began as to what they should do and where they should go. And that squares with a White House that, you know, through the entire course of the summer was really not engaging in protective measures to any great degree. I mean, people inside the White House where the confines are really cramped. The halls are narrow, the offices are small, there's a lot of people piled in there. They were just not wearing masks, not social distancing. There was some testing early on, but even for the reporters who go into the compound, they backed that off during the course of the summer and got actually less stringent as the months went on. And now there's some concern around people who are familiar with what's happening inside the White House, that there just has not been enough communication, no orders about what to do, where to go, how to handle all this until maybe as late as yesterday. So again, some frustration on that front.
Shepard Smith here. Thanks for watching CNBC on YouTube.